Come. Sorry, you've been waiting from morning.
Yes.
Yeah, I had 2 surgeries and all these things happening in between. Oh yeah. So a very short and retruded chin. Can you smile? Okay, let me tell you what are all the changes that you can expect. English is okay, right?
Yeah.
So the first thing is this height will increase a little bit. This will come forward nicely. Lip size will get lesser.
Yes. Okay. It will go inside.
A little bit go inside, little bit because the muscles are going to get stretched forward. So the size of the lip will come down. All are positive things.
I have seen videos from 2 years.
Yeah.
Watching the videos.
So you have any doubts or no doubts?
I know the whole procedure.
Okay.
But I have some doubts.
Sure.
The lower bone will come outside.
Yes.
The bone will develop. Okay.
Okay.
Here side, the bone will increase. You will get it down
Forwards.
Here between the bone will increase. Side also will increase.
So in your case, because this is little bigger, what I will be doing is what is called as an extended genioplasty. Meaning, till here is genioplasty generally around the mental nerve, but I'm going to go back for you. Little bit back. Why? Only then when I do that, that gap will not be seen. It will be hidden under the muscle there. If I make it here, you will get a depression here. That will not look nice. So you won't get any depression like that. Don't worry about
of that mental noise.
Nothing will happen to the mental nerve. You are a doctor or what? No. See, we have to work around the nerve. Nothing to worry. That's why we take video, we take pictures to say how we work around the nerve. Nothing to worry. So we'll plan tomorrow morning first case for you because you're already late and all that. So you don't please have anything in the morning. No water, no breakfast, nothing.
Today I didn't eat morning.
Today you have now dinner because tomorrow we'll plan morning first thing for you. You have to stay for 4 to 5 days and results will be very good. Shave. Mustache if you don't want, it's alright, but just have a clean shave.
I shaved night only.
Okay.
Full bird.
So tomorrow morning you shave before surgery, 6 o'clock. No trimming it, shave it fully.
Shaved that full bird. Actually, I'm hiding it from years.
Now you'll have a nice. You can still keep a beard. The beard also will look better only.
Yes, sir.
So the projections going to be more.
I'm saying that I'm hiding that small chin from years.
Yeah, no problem. All right.
Everyone, we are here at the pre-ICU, that is the pre-surgical area, and we have a patient for genioplasty, that is for the chin surgery. Look up, sir, a little straight for the viewers. One look at his profile and we see that he has a bulky lower lip. But the reason for the bulky lower lip is more than just say a lip mismatch or a lip defect in the lip thickness. It's got to do with his chin. If he looks straight, that is towards me, and on the side profile, we see his lip is too short and it's receded. It's inside and it's deficient in length. So what he basically needs is a chin lengthening as well as an advancement. So it will be a genioplasty for both vertical and horizontal advancement for him, which will start in minutes. We'll also guided him as to how it will change his lower 1/3 of the face, basically a more harmonious facial proportion. And yes, there is going to be an involvement of plates and screws, but those are biocompatible because they're the highest grade, the titanium ones that we use. Let's look a little straight for our audiences. So there's going to be a change in the entire lower 1/3 profile of the face. Yes, genioplasty is routinely performed, so as to say, mostly every second day or every third video that we put across. But it's widely used because it's popular, and it's popular because it's very diverse, can be used in combination with different techniques and improves the face to a remarkable extent. Let's see how the change looks for him. Thank you.
Just done 14 millimeters of horizontal augmentation, 6-7 millimeters of vertical augmentation, and that's how he looks right now. Very strong chin. The loose tissue around the submental region disappeared, and we're going to show you how he looked before the side view. And you can see that his chin was really behind. You can appreciate that. And now look at that. So that's what bony, extended, sliding, horizontal and vertical augmentation genioplasty can do for you. The good news is this is also for life. Not only his aesthetics will be improved, also his sleeping and breathing to a great extent.
Everyone, here we are with the patient. 5 days post genioplasty. We will proceed with the dinoplasty removal, which is the scariest part for the patient. I'll go slow.
Okay. Apply more. Apply more sanitizer.
Okay.
Please.
Okay, just keep your hands down. I'll apply. It's all soaked up. Oh, it's coming off quite easily for you.
Slowly.
Okay.
Surgery is not pain. This is
Surgery
pain.
is not painful?
This is
Okay.
painful.
You want to try this on your own?
Yeah,
Yeah, you can?
I can do.
Okay. It's already soaked up.
Yeah. Give that.
We were careful. The stitches are there, that's the only reason I'm holding it.
Yeah. Where is it? Okay.
If you do it like this, it will hurt you more.
Okay.
Okay.
Eight.
Okay, we'll start it from this side then. Come. Okay, give this to me.
Apply more sanitizer.
Okay.
Please. Hey, doctor, please. Pour this side.
Pour this side,
This whole side. Whole
Keep
side.
your hands down first, yes. You won't even understand, it will be out in minutes. Okay, keep your hand down now.
Okay.
Keep your hand down.
Okay.
Keep your hand down. I'm going slow.
Use it.
Okay. Nidhi, now keep your hands down, both your hands down for
Yeah,
5 minutes.
okay.
Yes.
Yeah, okay. Slowly.
Yes, very slowly I'll do.
Slowly.
Okay. Okay. As slowly as possible. Wait, we'll give you a mirror such that even you can look as to how the results have come out. Right now there's swelling for you, slight swelling here. Yes, I can see there is swelling here. But you had a very...
I've seen the video. You already uploaded my video.
You saw the video?
Yeah,
Okay. You think it's a marked change, dramatic change? We'll also go on to... Yes. Yes, there is swelling. There is swelling. You see how the vertical length of your chin and also the horizontal thing. If you look on the side, you can appreciate it better. Yes. Right? There is swelling right now. There's swelling over the entire chin area. Don't worry. That's the Dynaplast tape which was there. We'll clean that all that off. Don't worry. It's not a skin tag. Okay? But what I'm trying to point out is the anatomic changes which have come out after the surgery. Turn one side, turn towards your right or left. Yes, towards your left is fine. And you can appreciate the image. Sir, look in the mirror. You see the chin here. You can see the pre-operative image. You can?
Yeah.
So this guy had a really short chin. By short, it was receded. He needed both horizontal as well as vertical augmentation. It was an extended genioplasty for him and huge amount of horizontal advancement as well as vertical lengthening to give a proportional lower 1/3 of the face. We can see the before pictures which was taken just 5 days back. It's not even a week post the surgery. Swelling does exist everywhere, but it's been a huge change, especially in changing the profile, the facial profile for the patient. We'll go on to see other pictures as well. Yes, turn this side. Apart from the Genioplasty removal, which is painful, how was the surgery? How was the post-operative pain? Your stay?
Yeah, everything is fine.
Smooth. What about the food that you're eating right now?
Only juices.
Soft solids. Yeah, that has to be. We always tell patients to be little cautious because there are stitches intraorally inside the mouth. We don't want them to be infected. Medications will be continued for another week or so. We will give you a follow-up number. Be in touch with us. Okay. Swelling will take time to subside. It's already on the left side for you. Okay. Yes. No hitting your chin. Try sleeping straight as much as possible. Continue soft solids for another week. Okay.